All right. So, hello, how are you doing today?
I'm good. How are you?
Doing good. All right. So, to just start off, tell me a little bit about you and what made you want to get into equine medicine and veterinarian track.
So I am, I guess, first generation veterinarian. Yeah, like I don't come from a family of veterinarians, but knew pretty early on that I wanted to be a veterinarian. I grew up riding horses, grew up barrel racing a little bit. Um, Always really enjoyed like science and math in school. So it kind of seemed like a nice way to put the two of those things together. Sorry,
Yeah.
there's going to be a lot of background noise. I don't have a
Yeah, all good.
singular
Yeah.
office. um, so that's why this is happening outside.
Yeah, all
Um,
right.
I went to undergrad at Augustana College on the border of Illinois and Iowa in the Quad Cities. Then I went to the University of Illinois for veterinary school.
Hmm.
Like I said, knew from a very early age, probably like second, third grade, that I wanted to be a veterinarian. Took me a while to get to realizing I wanted to specialize in horses per se, mostly just because I didn't know enough about the profession to realize, I had to kind of pick that path a little bit. In my mind, it was when you're 10 or 8 or 9 or whatever, you're like, oh, a veterinarian, they just see all the animals all the time,
Yeah.
which some do, but we realized pretty quickly, I didn't really want to see cows. I didn't really want to see sheep. Didn't want to do some of the more like food animal species. So by the time I was in veterinary school, I was pretty committed to just being an equine veterinarian.
All right. And then going through school to be a vet, what was like your biggest struggles like going through school as far as
Um,
classes or mental or
Yeah,
anything?
biggest thing is, and and they told us this on the first day. I just didn't quite believe them. Is just realizing that like the way I was used to studying, like I got really good at cramming. Like I could kind of go through things once or twice and otherwise be fine. Like I was, like undergrad was reasonably easy for me. Um, hence why I was able to graduate undergrad in 3 years. Like I had to completely relearn how to study. And that was probably the hardest part, is all the usual study tactics that I had just they didn't really work anymore. The volume of information was too big. There was just too much, being thrown at us every day. Um, so I really had like a lot of the typical study strategies I'd learned, like they don't work. You got to kind of completely reteach yourself how to study, how to retain, how to understand. That was probably the biggest challenge.
I got you. So basically just like the like studying part of it and just like teaching yourself over again
Hmm.
how to study and how to do school pretty much.
Yep, because it's
Actually.
nothing like I'd ever. It was like no school experience I'd ever had before. It was
Mhm.
intensive. It was just long, exhausting, worth it in the end, but it's a long 4 years for sure.
All right. And then after school, what led you to work at Brazos Valley Equine Hospital?
Yep. So I ended up. It was kind of weird cosmic circumstance. Um, on the first day of veterinary school, I ended up sitting down to next to a gal who would become one of my best friends. She and I quickly became fast friends. She's actually from California, and is back there. Currently now we're still best friends. Just saw her a couple weeks ago. But anyway, she was big into kind of horses, barrel racing. Kind of was gonna plan to be an equine vet herself, or was kind of maybe a little more on the fence, between small animal medicine and equine medicine than I was, but was strongly considering equine medicine given her horse background and her rodeo background. Um, as we progressed through veterinary school, I got to know, obviously got to know her better. She became one of my best friends. Her eldest sister, is our main repro veterinarian here, because her eldest sister and her brother-in-law, are both veterinarians. Like I said, her eldest, or one of her older sisters, being our reproductive specialist,
Mm.
and her brother-in-law being our surgeon. So obviously, they came to visit her in veterinary school. I got to meet both of them. They told me about, kind of what their paths looked like, because they both had been in Texas the majority of their careers. Um, and kind of got to know them, got to hear about some of the practices they worked with down here, the practice they we all now work at, because I work at the same practice as them now. Ultimately decided that's where Texas was where I needed to go, despite starting off in the Midwest. Being born and raised in the Midwest. Um, the horse populations in Texas were calling,
Mhm.
and so the job and career opportunities down here were too good to pass up.
I got you. That's really good. And how has your experience been at Brazos Valley Equine Hospital?
Chaotic, honestly. The first year was quite chaotic, but I was one of our interns. So the hours were long. Learned a lot, learned more than I could honestly probably absorb in 1 year. But that's kind of the goal of any good internship, is you're not necessarily going to say you loved it while you're in the trenches.
Mhm.
And you're not going to kind of realize everything you're getting out of it per se. But it ended up being, it really helped jumpstart my career and give me a really solid foundation that I've been able to utilize now as an associate. Because obviously I stayed on after my internship, my year long internship, and am now an associate veterinarian here, going into my second full time, or my second year as a full time associate. And it's just the opportunity, like everything I continue to learn, because everyone here has a decade's more experience than I do. So there's I'm still, even though I am have been an associate now for a year and a half to 2 years. There's I'm still always learning nuance, and kind of new details, new research that's getting published. um
Got you.
there's always something that I'm gleaning here. And there's just the room for growth I have here, had here when I signed on, and continue to have, is kind of the big reason I stayed.
Got you. So like there's like a lot of learning going on,
Mhm.
like no matter what.
Yep.
Okay. So now going into like some basic like questions about wellness and stuff like that to kind of shift it. So so would 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 you agree that a horse's nutrition is the biggest factor in the overall wellness of the horse?
I'm not sure I would say biggest. I'm not really sure there's any one that is the biggest. I think they're all equally valuable. Nutrition obviously is quite important, as far as if a horse is essentially under nutritionally valued, can predispose them to a lot of different disease types, disease processes, compromises their immunity. But that being said, that's true of kind of any factor of wellness. Like, if the environment is poor, it's going to contribute to poor nutrition. If overall horse care is poor, that nutrition is going to be poor. um and like the horse, again, if the horse is in a muddy, disgusting environment, they're going to be predisposed to disease just as much as if they're nutritionally underfed. Kind of all the key pillars of wellness, as far as proper care, proper environment, um proper nutrition, like they're all the pillars. I wouldn't necessarily say one is more important than any of the others, because they all contribute to solid overall health.
Okay. So they're like pretty much equal
Mhm.
as far as it. So it's like a balance
Mhm.
of
Exactly.
everything. Got you. And then what is the body condition score you'd recommend for leisure horses, and then also for like more like barrel racing horses and like heavy work horses?
Honestly, I would say all of them should be kind of the standard body scale I used, is a 1 to 9 scale. One being emaciated, like that's your horses that you're pulling them out of a essentially a humane issue situation. And then 9 being a humane issue for a completely different reason, because that's your obese horses
Mhm.
that are usually dealing with severe metabolic disease, lots of other essentially obesity related problems. um I would say most if not all horses, like I don't think you really there's a really a differentiation between leisure versus performance horses. They should all be sitting at about a 5 being kind of your ideal body condition, not too skinny, not too heavy. I would really say that's the goal for all horses. The leisure horses, most people end up tending to keep them, or maybe the 6, to 7, or usually maybe more the 5 to 6. But in the ideal world, they should all be a 5.
I
It doesn't
got
really
you.
matter what they're doing. They should all be kind of in
Right.
appropriate condition.
Okay, that makes sense. I just wasn't sure if a
Yeah.
more like athletic horse should have a higher body score since it's just doing so much extra work. Or
No, because that ultimately that can, like I said, that can still predispose, like over nutritionally compensating for them. Like I said, it can lead to metabolic issues. It can cause its own problems if you're, trying to calorie load. Um, can still cause its own problems.
I got you. So then most people want to stay out of the vet's office. So what are some good like preventative things that people could do with their horses to help them keep out of the vet's office?
Honestly, a lot of that boils down to just do the routine things. If it's your, make sure that if you want to avoid the unnecessary visits, the midnight emergencies, the midnight colics, like don't be changing their diet pretty substantially. Be cognizant of changes in their environment causing stress. Do their annual vaccines. Get the dentist out there, or whether that's your veterinarian or whether that's a licensed equine dentist. Do their dental, even if it's just a dental exam, may or may not need to include a float, but get their teeth checked at least twice a year. Make sure that they're getting shod by a reputable farrier, or whether that's shoes, whether that's just a trim, but like take care of their feet, because 90% of lamenesses usually results from foot problems. Like just do the wellness work now to reduce needing to make those emergency visits in the future.
Got you. So, and then what is the most common disease or issue you see in horses that come into the clinic?
um Honestly, like, probably most common is colic.
Colic, yeah,
Which,
that's what I
colic
said.
being the umbrella term for any kind of essentially gastrointestinal problem. That's Colic isn't the umbrella term for a number of different pathologies, whether that's impactions, strangulating obstructions, displacements, and anything. There's it's like it covers maybe about a dozen different disease states of the gastrointestinal tract. Probably next up there is respiratory disease, and that comes from either people not being cautious when they're taking their horses off property or letting them interact with other horses that they might be not in, kind of, direct contact with a lot. We see that a lot in boarding facilities too, where horses are coming in and out all the time. So that, that your horse, even if your horse is at the boarding facility and you're, in your mind, you're like, oh, well, I don't take him anywhere. You still got to be cognizant of the fact that many other people at the boarding facility will be taking their horses other places. So even if you're, the analogy I always tell people is, even if you're not sending your kid to the playground, every other parent is sending their kid to the playground, and yours will get exposed, just via direct contact with those that have come and gone. So vaccinating for strangles, for flu, for rhinopneumonitis, like all of those major respiratory diseases is just as important for the non-traveling horse. As I said, for the boarding facility, if it's the horse that, you have your 3 horses at home, they don't go anywhere, you trail right on your property, is strangles hugely important? Probably not, but still worth vaccinating for anyway. Um, but those the kind of colic and respiratory disease, and then again, foot associated lameness from other, kind of maybe overdue, foot care, poor pasturing environment, wet stalls, etc., predisposed to foot abscesses, all those sorts of things.
Got you. It's
Kind of
like
be the top three.
yeah, it's like the same thing. I've like fostered dogs before and done all that. And the shelters, it's the exact same way, you know. You have no clue where like X, Y, or Z dog has been. So it all just kind of gets mingled up together. And it's like the same thing can happen in the stalls and boarding places
Hmm.
or facilities. Um, and then you already answered like what causes it. So what is a good way to like prevent the foot issues and stuff? You're saying to like keep the stalls dry, keep them
Yeah,
clean
like
all
make sure
the
to
time.
be, cleaning them once or twice, like once a day, once every other day. Be doing make sure there's, they're not standing in, just nasty shavings, their own manure a lot, urine. Make sure if you're turning them out on pasture that, even if, even if you have some water in it, make sure there's dry areas of it too.
Mm.
Or just, make sure to pick out their feet, if there's, raw, if you live in particularly rocky terrain, just do a lot of the very easily preventative foot care. Those sorts of things. And then, as for colic, it's, make sure to continue their standard, maintain a regular diet. Don't make any really dramatic changes. Transition feeds carefully over the course of probably 5 to 7 days. Those sorts of things.
Yeah, it's like I've worked with cattle before a lot, and because my family they have a farm down in Mississippi, and it's down on a river bottom, and like foot rots are like really big thing
Mm-hmm.
with cattle. It is that also the same thing in horses whenever they get
Horses don't really get foot rot per se. Foot abscesses are usually
okay.
the most common. Um, and then like white line disease, and then probably like laminitis are kind of the three big pathologies of the foot,
Mm-hmm.
um, that are a byproduct of environment. Um, and then obviously kind of poor farriery, for the farrier that isn't as cognizant. Which again, that's there's I mean like that farrier is the exception to the rule. I know more good farriers than I know bad.
Mm-hmm.
But, the farrier that doesn't isn't doesn't have an attention to detail while he's working on the foot, and then your angles get screwed up, whether it's palmar angle, whether it's hoof pastern axis, all those sorts of things.
Mm-hmm. Got you. And then um so. Where was I at? So how does genetic makeup affect the horse's overall wellness?
Um, usually genetics plays more of a role. It's very breed dependent. Like as with anything, genetics more creates predispositions for disease rather than truly contributing to disease. Um, so miniatures, ponies, often are have a genetic predisposition to laminitis, metabolic diseases like pars pituitary intermediate dysfunction, equine metabolic syndrome, those sorts of things that all kind of play a role together. um Draft breeds off or sorry, quarter horse breeds are have been bred to have a lot of kind of different genetic muscle problems, whether that's talking HYPP, polysaccharide storage myopathy, um, blanking on some of the other ones. Arabians often have like HERDA, different kind of developmental neurologic and vertebral diseases. That's kind of where that's probably where the most where genetics plays a role. But it's not something like genetics, they're like there's genetics for weaker immunity. Those don't really exist to my knowledge. um there's definitely genetics to some degree that determine musculoskeletal soundness. We're seeing with some stallions that if the stallion has had the stallion had stifle problems, a lot of the offspring are having stifle problems. Those sorts of things because developmental osteochondrosis dissecans, which is cartilage defects, are very much heritable. So you're seeing a lot of those. If the stallion was predisposed to OCDs, then often the offspring will have very similar OCD presentations as well. Unless again you're matching it with a mare or a dam, that maybe didn't have any problems, has had no history of lameness in those joints or kind of what have you. But that's it's usually predispositions more than anything, rather than true contribution to like they are wildly more susceptible, because their immune system's just weaker, if that makes sense.
Mm-hmm. That makes sense. So it doesn't really go back to the like genetics of it, more just the immune system. All right, and then you mentioned HYPP, and it's caught my attention as well. So whenever we're talking about it in class, and since the muscle spasms are caused by high amounts of potassium, if I remember right. What's a good low potassium feed to feed them to kind of help?
Honestly, I don't know which feed would be best for that off the top of my head, because honestly we don't see a ton of it these days. Like the number of horses I've seen in the last 3-4 years that have actually had true confirmed HYPP is one, maybe two. It's honestly, it's for the most part, it's been bred out. Um, just maintain like any good well balanced feed. People try to make nutrition more complex sometimes than I think it needs to be. Any of your good reputable feed brands, whether it's Neutrino, whether it's Purina, Triple Crown, like a lot of those have just overall very good, well balanced feeds to begin with. I feel like you see a lot of those things when people are trying to severely supplement electrolytes, those sorts of things.
Hmm.
But honestly, like I said, for the most part, a lot of genetic diseases like that are being kind of bred out finally. So we're seeing a lot less of them.
All right, that's good. And then so you said it's not common, but like let's say a person had a horse that had a HYPP, could they still use it in like Western events or like
Oh yeah,
English style events?
yeah. No, even if a horse had like, I will say the thing that might stop them is if they are going to register this horse. A lot of the registration, in order to register a lot of these horses now, you have to do their full 5-6 way genetic testing panels. Um, because it's again it's the way that we've been trying to kind of breed it out of quarter horses particularly. So kind of when you go to register yearlings, foals, etc., you're having to submit genetic testing on them as well. But as far as if it's just a backyard horse that has probably has HYPP or whatever, you're absolutely still able to compete them. You just kind of got to be cognizant that events could happen and kind of what their triggers are. Um, because there's always a risk it could happen. Some of them can be reasonably well controlled, and there's oral medications like acetazolamide that can help kind of manage if they have episodes. But like I said, for the most part, it's been getting bred out pretty frequently. The number of cases we genuinely see is pretty minimal.
Got you. And then speaking about breeding and everything, I also read that you also do a lot of stuff with a reproduction there.
Mm-hmm.
So just a couple questions over that topic. Do you prefer live cover or AI breeding?
I personally prefer artificial insemination. But some breeds it is like artificial insemination is not allowed, namely thoroughbreds. Thoroughbreds all have to be done by live cover. So it again, I can do pre and kind of post ovulatory checks, just to confirm that the mare has ovulated appropriately. But that's the thing I like about artificial insemination over live cover is I have a lot more control over and can better manipulate their cycle than if it's just a check them, make sure they're building a dominant follicle. Let's try turning them out with the stallion in 3 to 5 days. Um, there's a lot more room for error, and there's a lot more times that more often than not people aren't necessarily following up with that. At least in the live cover situations I'm dealing with, which again it's a lot of cases down here it's not necessarily thoroughbreds getting live cover. It's more of a Kentucky thing. But usually when people are bringing horses to me that they want to take for live cover, they'll come to me 6 months later and be like, oh well, she's pregnant, right? And I was like, well, we don't know because we never confirmed that she ovulated within the kind of the appropriate time frame based on when she was live covered. There's always questions about well, did the stallion truly ejaculate? Because they're like, oh well, he covered her, and it's like, well, but did a viable dose of breeding dose of semen actually get in her? There's just a lot more variables and ambiguity in relation to live cover. Not to say it's been effective in thoroughbreds for years. Not to say it's not effective. But it's there's a lot more ambiguity. It's probably the best word. And just a lot more variables. So that's why I personally prefer artificial insemination because you can get a breeding dose, and even if the swimmers are not not up to par, there's other things I can do at that point, whether I'm doing deep horn, artificial insemination, spinning it down to kind of concentrate the dose, remove extender, etc. I can do a lot more to try and help increase the odds that mare gets pregnant.
All right. So AI is definitely the way to go, it sounds like.
Like I said, it's my preferred method, but in some breeds they genuinely won't allow it.
Yeah. Yeah, yeah, we had a lady come from Kentucky a week ago, and she was talking about the whole thoroughbreds up there and everything, how you can only use live cover
Mhm.
for the registered ones and stuff like that. So it just piqued my interest on which one you thought was better, because she was definitely for live cover over everything else. So I was just curious because also like a lot of a lot of my classes I'm taking now, they're all like production animal classes, and it's just AI only
Yeah.
is most of what we're taught. So just
Yeah,
curious.
no, it's like I said, the jockey club is very restrictive of, it's live cover only because they are trying to also, part of it has to do with controlling the genetics of thoroughbreds. Because the moment you allow, embryo transfer, artificial insemination, you open up the door for embryo transfer for ICSI, which is intracytoplasmic sperm injection, basically, the equine equivalent of in vitro. Um, once you open up the door for artificial insemination in thoroughbreds, it's going to dramatically change what their genetic makeup or what their genetic pool is, because you'll start getting everyone's going to be trying to breed to all the same horses. It's also the reason that the brood mares, even if they are crippled, have terrible feet, are 20 something, like that's the reason why the broodmare market up there is still what it is, because that's you can't just flush it, flush the embryo out of them. They have to physically be able to carry it. It's part of the reason podiatry, equine podiatry kicked off so big in Kentucky, is because it was trying to make sure brood mares, the really crippled, foundering brood mares could still continue to at least carry another one or two more, foals before they had to be put down. Versus down here, if something's really really that crippled, you flush a couple embryos out of her, or do ICSI to try to get have a bunch of embryos to freeze, and then she can be put down, if that makes sense.
Yeah, no, it does. Definitely does make sense. So so whole goal breeding is to get a foal, obviously.
Mm-hmm.
So what is the foaling process like? Because I'm also taking the foaling practicum, which is like a foaling lab,
Mm-hmm.
next semester. So what should I expect? Because I don't know much about equine, honestly. So I'm kind of going into it a little bit blind. So what's all the foaling process like and everything?
Foaling process on most mares will foal anywhere from about 10 p.m. to about 5 a.m. or 5 or 6 a.m. They almost always all foal at night. Occasionally we're lucky and that we'll have a mare that'll foal at 5 o'clock, or have a mare that'll foal at 8 a.m. But it's definitely more the exception than the rule. Most mares, can be exhibiting signs of kind of, you know, parturition occurs in usually 3 stages, or should say occurs in 3 stages. Stage one being, they're kind of looking mildly uncomfortable. Maybe or may or may not have had their water break. Because water breaking is kind of it's the signal that they're entering stage two. So they can be in stage one and go in and out of stage one, repeatedly. And this could go for hours to days. Um, they could be in stage one for 24 to 48 hours, where they're, maybe, you're seeing them look a little restless, like maybe they get up and down a lot, lay down a lot. And you're like wondering, like, okay, they're close, or they're probably stage one. But it's mares also, because they're often foaling in the wild. That's part of the reason they foal at night, is because, again, foals are delicate. So they need a little bit of time to kind of, be able to get up and get rolling. So partially that's why they fall at night, is predation and all of that. It's how they've adapted to kind of survive predation. Um, so you state, like I said, stage one can go for, kind of, they can go in and out of stage one. Once their water breaks, they enter stage two. And that usually, pretty much once they enter stage two, yeah, you're not going back. That's you hit stage two, it's happening. There's no more kind of, we're going to float in and out. It's, they are usually on the ground or walking around, baby, starting to come out, like they are having active contractions. They are in active labor. Baby should be out, usually in about 15 to 20 minutes, is what we tell most people. I usually give them 10 or so minutes to try on their own, and then, because if that baby is not out by the 20-minute mark, then we're walking them over for a C-section, or at least to do, like, gravity assisted delivery, things like that. um And then stage 3 is passing the placenta, and that should occur within about 3 hours. That placenta should be out, should be intact. It's in a lot of really routine mares, that are used to having foals a lot. It can be out sometimes almost instantaneously. Like you'll be working still on kind of just rubbing the baby down, trying to stimulate the baby, and then they'll pass their placenta over in the corner. But then some mares, will hold on to it a little bit longer, and some will try to retain it all together. It just depends. But that's kind of roughly what the stages of labor look like.
Okay, got you. Thank you for the insight. That sounds like it's gonna be interesting, something new, and I'm excited to do it. And thank you for talking with me today as well. I appreciate
Absolutely.
it. And is there anything else you want to talk about, or anything else you want to say?
I don't think so. Anything else you got for me?
No, sir.
Alrighty. Well, then it was good to talk to you. I hope that answers your questions. Hope that helps. And I guess that's it.
Got you. Thank you.
Of course. Bye bye.
Bye.